Hi, I am a care coordinator at Iredell Memorial Hospital. Today I would like to review with you some simple tasks to complete prior to surgery so that you will have a home environment that is safe and promotes recovery following your joint replacement. Take the time to organize and clean your home. Make sure there are clear pathways large and wide enough to easily accommodate a rolling walker. Pick up all throw rugs and store them somewhere out of the way. Any loose rug can be a falling hazard, so this is an important step. Make sure all electrical cords are out of your walking paths. Install night lights in your bedroom, bathroom, and hallways. This will help you see more easily in the dark as you navigate your home with your walker. If you live in a multi-level home, you may want to consider staying in the first level near a bathroom. We do not expect you to need 24-hour care, but you may need someone to assist with the care of your pets, collecting your mail, cooking meals, personal care, and light housekeeping. Please also make sure you have a designated person to transport you to the hospital for surgery and home at time of discharge. All of this information, as well as some other helpful recommendations, can also be found in the Total Joint Replacement Handbook that you will receive at the Total Joint Replacement class or your preoperative appointment. Thank you for choosing Iredell Memorial Hospital for your joint replacement needs. We look forward to working with you.